Our theme today is simple to say, but quite demanding in practice. Food security is health security. And over the next couple of hours, we'll be looking at how empowering farmers and communities, not just delivering inputs or projects, can measurably improve health outcomes in the districts where y'all work. This is not about turning you all into agronomists, but it's about adding a food security lens to the global health work you all already lead. So, a little bit about myself. I come at this from the agriculture and extension side rather than from the clinical side. I founded IDEA back in 2013 after serving as the U.S. Army's Agricultural Development Officer in Afghanistan. And since then, I've worked on program design, farmer training, extension professionalization, and market systems in more than 45 countries. But I was inspired to pursue this career path because of my dad, Dr. David Vanderpool, who is a member of CUGH and is actually going to be speaking tomorrow. He has committed his life to serving in low and middle income countries via his NGO, Live Beyond. He is a surgeon and a tropical medicine expert, and his life of service and love working in Mozambique, Honduras, and Ghana before moving full time to Haiti and expanding to the West Bank and Israel as well as India has consistently motivated me to live beyond myself and serve others as well. And seeing how he had the whole healthcare side of things nailed down, I decided to focus on food. And that led me to study agriculture and farmer education. Most of my academic work is in international agricultural development, and everything we do is aimed at one thing, turning good research and good intentions into daily practice on farms and in markets. One thing our team does is we publish a weekly national agriculture, market, and farming weather report for the entire country of Uganda that currently goes out to about 18,000 readers, including farmers and extension agents. So please, I want y'all to think of IDEA as a bridge between your world of global health and the world of smallholder farmers and local food systems. So let's begin with the basic link. Nutrition shapes immunity. If a pregnant woman is anemic or a child is chronically undernourished, every infection hits harder and recovery takes longer. In Haiti, my dad's NGO, Live Beyond, opened a maternal health clinic, and every day hundreds of pregnant and nursing women would come into the clinic to receive care and education. But we quickly realized what they lacked was adequate nutrition. And so I constructed a chicken coop near the clinic, and we started serving fresh eggs to the mothers every day. Their nutrition improved, their pregnancies were healthier, and the mortality rate plummeted. And while the clinic expanded its kitchen and nutrition services, we wanted the impact to go deeper. Now, the mothers and their families are trained and equipped to raise their own chickens and produce more of their own food, dramatically reducing the malnutrition throughout the region. Food access shapes disease burden. When families run out of food or can only afford low quality staples, we see more preventable illnesses, more complications, and more stress on clinics and hospitals. Local food systems shape community strength. When a community's food supply is fragile or entirely imported, any shock, a conflict, a flood, a price spike, quickly becomes a health crisis. So, the central claim of this session is that better diets and fewer hungry months translate directly into fewer preventable illnesses, better recovery, and stronger community health indicators. When we invest in food security, we are investing in health security. And so now I'd like to actually do a poll. Let's do poll number one. Do you believe food security is health security? Yes, no, or unsure. I'll give y'all a second to fill out this poll. See these answers coming in. Thank you all. So far, overwhelmingly, yes, y'all do think that food security is health security, though we do have a couple of people who have voted otherwise, and I will now do my best to convince everyone that it is. Excellent. Just to confirm, you are still able to keep seeing my slides. Okay, great. So let's add some data to that intuition. Globally, around 673 million people are facing hunger, and about 2.3 billion experience moderate or severe food insecurity. That is nearly 1 in 3 people on the planet. And just as a note, I will be sharing my slides, and all of these hyperlinks go to the sources for my statistics. So you should be able to click and read more if you're interested. On maternal and newborn health, roughly 37% of pregnant women are anemic. That is linked to over 115,000 maternal deaths and close to 600,000 perinatal deaths each year. Better diet quality and iron intake substantially reduce risks of preterm birth and low birth weight. For child growth, about 150 million children are stunted. Household food insecurity increases the odds of stunting and being underweight, especially in lower income countries. And on the disease side, severe acute malnutrition, whether kwashiorkor with edema or marasmus with wasting, is a direct expression of food insecurity. And if you look at conditions like tuberculosis, food insecurity is associated with higher risk of treatment failure and death. Even mental health is affected. People facing food insecurity have significantly higher odds of depression and stress. So we are not dealing with a vague social determinant. Food insecurity shows up like a multi-system pathology in your health data. On this slide, you should see the World Food Programme's hunger map. I'm not going to walk through every country one at a time, but the point is the pattern. Let's zoom in to Uganda, where I have about 20,000 farmers in our agriculture program. And you can see, according to the World Food Program, nearly the entire country, there's 2 districts that are not in the very high prevalence of insufficient food consumption. The whole rest of the country is very high, with Nakapiripiri and Amudat in high and moderately high. And this is by all comparisons, a fairly developed country, a good economy, and yet this much hunger is prevalent. We can zoom out and see other countries and their the different factors, conflict alerts, climate shocks, and other incidences that are happening all around the world, and the different effects that go into place when food consumption is insufficient, when hunger is high, and how that all plays together to dramatically affect global health. The hotspots you work in as global health professionals, the conflict zones, the fragile states, and the climate stress regions are also the hotspots of acute food insecurity. So, where your programs might be straining, food systems are usually straining at the same time. You can see all of Haiti falls into the very high prevalence of insufficient food consumption. To move from problem to prescription, we need a simple lens. In that idea, we use 3 main pillars when looking at food security. We look at food availability, food accessibility, and food affordability. We also have some cross checks of quality and safety, dietary diversity and preservation. So, what do I mean by that? Food availability. Is there enough food in the system when communities need it? Mostly looking at production, looking at quantity, looking at the ability to store the crops that have been harvested. And is it reliable across the seasons? Food accessibility. Can people actually get that food throughout the year? Geography, markets, security, gender norms all sit here in the accessibility side. Does the food that was harvested at the end of the season last until the next year, or is it only accessible when it's available? And then looking at food affordability. Are prices low enough for consumers to afford, but high enough for farmers to survive? Are they able to afford to sell it at the market's rate? If either side of that equation fails, the system breaks. And then for our cross checks, quality and safety. Is the food contaminated? Is it infested or is it spoiled? For dietary diversity, are we talking only about a staple or are we looking at legumes, vegetables, and proteins that build health? And for food preservation, can households carry food safely through the hungry months? Is it going to spoil quickly, or have they processed the food in a manner that preserves it for a while? So now I'd like to go to poll number two. Which aspects of food security do you think is most important in your context? Availability, accessibility, affordability, or the quality diversity cross checks? Please pick one and try to remember your answer because we will come back to it later on. Great votes coming in. I appreciate how engaging you all are. Fantastic. Great votes. How about a few more seconds and then Miss Sarah, if you will share the poll so that everyone can see it. All right. Take a look at those votes. Most people voted that food affordability is the most important aspect, with a close second of food accessibility, then the cross checks, and then availability. Very interesting. Thank you all so much for voting. This Venn diagram of food security, something that IDEA uses when working with partners, NGOs, ministries of agriculture, and other community stakeholders. And I think this diagram puts these pieces together visually. So looking at the three pillars of food availability, accessibility, and affordability, we like to think of this as like a three-legged stool. Without one of the legs, the stool is going to fall over. But where they are all well balanced in the middle is where food security happens. But if one of the pieces is missing, we have a gap that needs to be addressed. So when all you have is food availability and food affordability, but you are lacking the blue circle of food accessibility, you'll have food that exists and it's cheap at harvest time, but then disappears, especially from the poor households later in the year. And food preservation is often an issue. When all you have is availability and accessibility, but you lack the red circle of food affordability, you often have quantity without diversity. This is the classic maize only diet, as households cannot afford more nutritious and diverse food. When all you have is accessibility and affordability, but you lack the green circle of availability, you might have cheap food, but it's low quality and the safety is also in question. So this is the diagnostic picture. In your own question, which circle in your own districts, the question is, which circle is weakest? And what does that do to the health outcomes you care about? Don't have a poll for this. I just want you to be reflecting on that. Where you work, which of these three circles is the weakest? And what does that do to the health outcomes you care about? So here's the same story, but maybe in more plain language. A nutrition gap from unreliable, low quality diets creates nutrient deficiencies, both macro and micro, and it raises maternal and child risk. Seasonality and cost. Those hungry months and price spikes mean families must choose between food, transportation, and care. Weak markets and incomes keep farmers poor and nutritious food expensive. Gaps in knowledge and capacity keep proven practices off the farm and out of local kitchens. And then shocks, conflict, extreme weather, and water stress often push systems over the edge. And so, ideas short prescription roadmap, a structure that we'll be talking about for the rest of our session. We look at protecting the harvest by cutting post harvest produce losses, localizing and making markets fair, focusing agriculture on nutrition, not just calories, and building climate and conflict resilience. So, everything we're going to talk about from here on out will fit into one of these four categories. So, let's start with protecting the harvest. In many of the places where we all work, post-harvest loss for grain and perishables can reach 30 to 40% of the harvest. That is lost nutrition, lost income, and lost health potential. And what I mean by lost is the quantity that the farmers harvested is lost somewhere along the line before it can be consumed. Often this is due to rot or pests or diseases of some sort that are growing in the produce. Sometimes this is due to literally falling off the trailer on its way from the farm to the market. And sometimes this is lost due to inefficient storage methods. But the average post-harvest produce loss in most of low and middle income countries is around 30 to 40%, and in some countries reaches even 60%. That is lost gains, lost realized gains, lost opportunity. But the key insight is that this is not only an equipment problem. It's not just that we need more grain storage bins or silos or PICS bags. It is often a systems and behavior problem. So, four high-level moves that IDEA recommends for improving the post-harvest produce loss mitigation strategies. One, start with building community capacity to protect the value from the field to the table. That means timing the harvest correctly, drying safely, and handling produce gently. One thing that needs to happen when we harvest our crops is we need to get the field heat out of the produce. So if you're harvesting your tomatoes in the middle of the day, in the heat of the day, all that heat is going to be inside the tomato. And as soon as you pluck it off the vine, that extra heat is going to accelerate the degradation, accelerate the decomposition. And so if we can remove that heat through any type of chilling mechanism, whether it is refrigeration or just getting it in the shade, or even better, don't harvest in the heat of the day, harvest in the early morning hours when it's still cool. I even know many traditional systems of harvesting under a full moon at night when you have even less heat. Those different strategies are going to really help the produce last longer, maintain that quality. But also the timing of the harvest. You don't want to harvest the crops too early where they're not ready for consumption. They're not able to be consumed, and so they'll end up decomposing before they're even fully ripe, or too late in the ripening process where they are so past ready that they decompose even quicker, and they don't even make it to the table to be consumed. but then drying safely, removing the extra moisture content from a lot of our produce, especially grains. The more moisture that is inside the crop, the quicker it begins to decompose. And so that moisture really accommodates different bacteria and fungi well, allowing decomposition to happen quicker. And so, oftentimes with our grains, as you can see in this picture with all this maize, they've been sun drying the maize on the tarps, and that helps dry it out, remove that extra moisture, and allow the quality to remain as high as possible for as long as possible. And then, of course, handling our produce gently. Go back to the example of the tomato. If you roughly handle the tomato and squeeze and bruise it, that is going to, you know, to use a health analogy, basically open up a wound in the flesh of the tomato fruit, allowing foreign infections to enter. And so we want to handle our produce gently to help it maintain its quality. Next strategy is organizing shared storage and handling facilities, especially if this can be done under local governance. A small community store or pack shed, if well managed, can change a district's food availability and prices dramatically. And so having a concrete building, just cinder blocks with a roof that's going to get our produce into a cool, shaded place, has incredible impact on the shelf life, the lifespan of that food. And of course, organizing farmers together to be able to use this shared space at the same time is going to extend those benefits to more people and accommodate more produce. As an example, when I worked in Afghanistan, one of the projects that we did was we built cool storage facilities. Excuse me. And these were basically root cellars that we dug into the ground, built walls and a floor for, had a lot of shelving in, and then put a roof over. But by being underground, it was able to use a lot of that cooling, traditional root cellar cooling techniques to maintain the freshness of the produce. And the majority of these Afghan farmers were actually apple growers. And so we were able to allow the apples to last longer post harvest when supply from the harvest had dropped and demand went back up. And now our farmers were able to sell into a high demand market and get a much better price point. Also, it meant there were apples available to be consumed post, that harvest season, allowing for continued consumption into the off season. So, organizing shared storage and handling facilities is a tremendous strategy for improving food security in communities. We also want to align incentives so that quality and timeliness are rewarded, not just volume. If you have a whole lot of a low quality produce, well, not that helpful. We want to ensure that quality is the goal and that we are working in a timeline that is going to be maximally beneficial. If everyone in the community is growing maize and everyone in the community harvests their maize at the same time, that means that market is going to be flooded with maize. The supply is going to be higher than the demand, most likely, causing the price to drop for the consumer, but also meaning the price is going to drop for the farmer. And so, if we can align incentives so that not everyone's growing maize at the same time, but some are growing a legume of sorts, some beans, well, that is going to allow the market to have a better diversity of produce and to also reward the farmers with better prices as they're not competing all against everyone at the same time. When buyers pay more for the clean, dry grain or the sorted vegetables, then the practices can also change quickly. When the buyers are educated to purchase and consume what is going to be best for them, then they will put that demand into the market for that high quality produce. So aligning incentives is very helpful. And then we want to pair our practice change with coaching. This is not just a one-off training where an INGO comes in, does a quick farmer field school or training session, and then leaves, but rather we want to have ongoing visits and peer learning that correct mistakes and build confidence and continue to grow the momentum that is developed. And so we like to enter into a community and stay there, developing relationships, raising up local leaders, and empowering them to continue the impact. From a health lens, every sack of grain that does not mold, every crate of vegetables that does not rot, is calories and micronutrients staying in the system. It is also income that is now freed up to be spent on healthcare. So, lots of benefits to minimizing post harvest produce loss. Now, the second move, localize to stabilize. Shorter, fairer supply chains make healthy food more available, accessible, and affordable all at once. So, four ideas here. Shorter supply chains. When you reduce unnecessary intermediaries, prices stabilize for consumers and more, the price is stabilized for consumers and more value reaches the farmers. That makes nutritious food both more available and more attractive to grow. Transparent pricing. Publishing weekly prices and scheduling predictable buyer days builds trust and reduces predatory behavior. Farmers can plan, consumers can anticipate costs. This is something that IDEA has found is vital within many of the farming communities around the world. Farmers often lack access to the information of prices. And so they are not aware of whether or not they're getting a good price from the middleman who is buying at their farm gate or if they're getting ripped off. They also don't know which market they should be selling to get the best price. And I'll give a very tragic story from this. I was working in India, working with farmers, co-ops, and agribusinesses. There were a group of farmers who were all growing onions, working with them on improving their methodologies, their efficiencies, their strategies for cultivation. But when I had arrived, these farmers had already taken out some very predatory loans to afford their seed and inputs. But working with them, we were able to get a great harvest. And I showed up a couple days after harvest to meet with them and see how things were going, only to find that even though they had had their best harvest ever, the local market was going to be buying onions, what they had been growing, they were going to be buying onions for about a penny a kilo, about 1 cent per kilo. And it was going to cost the farmers closer to about 50 cents a kilo just to transport the onions there. So they were going to have a huge loss just in the cost of transport. And much to my dismay, what the farmers decided to do was pile their onions up, light them on fire, and then commit mass suicide because the predatory loans that they had made was going to come at the expense of their families being taken as collateral. What really brought this to a point for me was we found out a market in the other direction was buying onions for closer to $5 a kilo. And if these farmers had only known which market to sell to, they'd not only be alive, they would have made a huge profit and it would have been a hugely successful season for them. That experience changed my trajectory significantly. And one thing that we have been committed to doing is empowering farmers with timely, relevant, and beneficial information, especially regarding market prices. And so, in our weekly Uganda agriculture, food market, and farming weather report, we aggregate market data from across the country, from 32 different cities across Uganda, finding the prices and publish them every single week for our farmers to know whether they should hold because prices are low, whether they should sell now and take advantage of the market, whether they should go to market A or go to market B, be empowered to know where best to sell. But that requires transparent pricing, which is something that's pretty difficult to come by. Next, community negotiation groups. Producer groups or community committees can negotiate with buyers, plan volumes, and reduce waste. This is also very helpful when farmers come together and are able to use collective bargaining to get the best prices. When they say we have formed a cooperative and together we are going to be buying our seeds or inputs in bulk, then we are able to demand a discount. And that is extremely helpful to the farmers. It's also helpful to input suppliers because they're making a bulk delivery, a bulk sale. But it also works the other direction when the cooperative comes to the market and says, we are, the local pigeon pea farmers cooperative, and we are going to be selling pigeon peas, and we are starting the negotiation for the price per kilo at this level. And by having that group negotiation, they're able to have better benefit. And then lastly, institutional procurement. This is where many of y'all come in. When schools, clinics, and social programs commit to buying locally, that anchors the market. It stabilizes farmer income and it puts fresh, nutritious food on the plates of vulnerable populations. So many of y'all have undoubtedly seen the unfortunately now extinct USAID sacks of food, which had printed on the side a gift from the American people, not for resale. And where do you see it most? At the local markets being resold. And while food aid is essential, especially during a crisis, it should be used as a crutch in the very short term and not as the solution. Food aid crushes the local agriculture system. It suppresses the markets, competes with local farmers, and erodes a community's ability to feed itself. But when food is grown locally and the community's farmers are empowered to feed their own people, then the food aid is no longer necessary and the crutch can be replaced by a cast, and then soon the leg is healthy enough to walk again. So, if you are designing health programs, you do not have to run the market system, but you can shape it through how your institutions purchase. Are you purchasing locally, or are you going to be importing food to then be distributed at the cost of the local farm economy? Next, I like to look at nutrition sensitive production communities can own, especially localization. Localization only helps if the food being produced actually supports health. So our third move is nutrition sensitive production. And the core strategies, we look at diversifying beyond a single staple. If everyone grows and eats only maize or only rice, or here's a little controversial statement, if everyone grows and eats only cassava, my least favorite crop in the world, you cannot fix anemia or stunting with a monocrop. So we want to diversify our production, especially into more nutritious crops. We also want to elevate the locally adapted protein-rich crops. My favorite crop is pigeon peas, and we can get into that more later. But by elevating pigeon peas, which are often more adapted for tropical countries and are very prevalent and well consumed in LMICs, pigeon peas, cow peas, orange flesh sweet potatoes, other indigenous vegetables. These are often well suited to the agroecology of the area and are more culturally acceptable. Next, we like to link agronomy to nutrition gaps. If a district has high anemia, we want to push iron-rich foods. We want to really use our extension services to advocate for better nutritional consumption. If there's a vitamin A deficiency, we want to promote the orange flesh sweet potato and dark green leaves. We want to link our agronomy to the nutrition gaps. There's not a one size fits all approach, but there needs to be the contextualization for where we work. And then I love to encourage home and community gardens that help bridge hungry months and especially empowering women and children. One of our major programs is we call these faith gardens. Faith being an acronym that stands for Food Always in the Home. And these are home gardens, community gardens, school gardens that employ a number of different excellent strategies that allow for a constant harvest. You have staggering planting, you have relay planting, and crop rotation. And then we use short-term crops, medium-term crops, long-term crops, and perennial crops so that there is a constant cycle of harvest. And by doing that, we're able to really bridge those hungry months. So this is where agricultural development and public health can really co-design. The question becomes, which crops will move our nutrition indicators? And how do we make them a good business for farmers? A little shameless plug. Here are some of ideas publications that are more nutrition focused. As I mentioned, I do not like cassava, and if we want to discuss that in the Q&A, I'm all open to it. Uh, don't like cassava so much, I wrote a book about it because it's so incredibly high in cyanide. And if not processed correctly, the cyanosis prevents iodine absorption in the body, leading to goiters and wasting. But it is very commonly cultivated, especially throughout sub-Saharan Africa and Latin America and the Caribbean and Southeast Asia. Even though it was only imported to sub-Saharan Africa and Southeast Asia starting about in the 1980s. Very low nutrition, but it has calories, and calories are better than nothing. So at least that's how the argument goes. Alternatively, I love cultivating pigeon peas, so much so that I wrote a book about it because it's high in nutrition, high in protein. It is just as drought tolerant. Actually, it's more drought tolerant than cassava, even though that is one of cassava's few accolades. And so I see pigeon peas as a great, preferable alternative. Uh, so very nutritious, and it doesn't poison you. And then ground nuts being a great cash crop, especially when grown correctly. Um, Ground nuts, G nuts, peanuts, whatever you might call it in your area, high in protein, high in calories and fat, but can be a little fickle when it comes to cultivation. And so having a guide has helped many of our farmers produce more. So the fourth move is resilience. Climate variability and water stress are now core issues because they affect our yields and our safety. And this is certainly a hot topic amongst many circles that are looking to address climate change, looking to address climate smart agriculture, and looking to discuss the different solutions going forward. Resilience is what our farmers must be empowered and equipped with to be able to continue to produce during these more difficult seasons ahead. So, things that we can do, we can prepare for variable seasons with soil conservation, water harvesting, and thoughtful crop timing. This reduces the risk that one bad rainy season is going to wipe out any of our nutritional gains and become a nutritional crisis. We also want to protect our water sources and promote safe water handling from harvest to plate to prevent contamination and foodborne illnesses. That includes everything like how do we handle our pesticides and other synthetic chemicals that we are applying to our fields, because if those get into the water system, it has many downstream effects on health, on the ecosystem, on productivity. The list goes on. And so protecting our water sources, this even is looking at soil erosion and how eroding soils can actually affect the water table. And so we also like to look at soil conservation through reforestation, as that's a great way to protect the water table. We like to stabilize yields with practices like mulching, intercropping, and integrated pest management. What are different low cost, low risk, high reward strategies that farmers can employ that are going to improve their productivity and their outcomes without having other unforeseen costs? And then lastly, and probably most importantly, we like to invest in local leadership so that adaptation knowledge is taught by peers, not just by visiting experts. I have worked in many, many, many countries, and I will never be the expert in any one of those other countries. There are great, excellent, well-educated, well-experienced local leadership, but often need just to be given the platform for their voice to be heard and shared. Also, they will be able to adapt the research coming out of the institutions to the context where it needs to be applied. And so, investing in local leadership often has the most impact of any of the work. If we think of resilience as a series of small teachable habits, every contour line, every protected spring, every farmer who shifts to a more resilient variety is now part of our health security strategy. Oh, another shameless plug. Here's some of my ideas publications that are more climate focused. Uh, Many of our farmers, especially this past 6 months or so in East Africa, have been dealing with extreme floods. The storms, the typhoons and cyclones coming through the Philippines and Southeast Asia have been especially damaging this year. And so flood mitigation has been one of our uh, more useful resources this past 6 months. But as we are going into a La Nina climate pattern, especially throughout the Pacific and the Indian Oceans, we're finding that the next few months are going to be more water stressed in terms of droughts. And so water resource management is also one of our often taught courses to the farmer field schools and the agriculture extension agents we work with. And then, of course, we have our common crop pests and diseases during the rainy season. This is a series that is always in demand around the rainy season as the pests tend to increase dramatically during that time period as well. Last mile knowledge, measuring what matters. But before we talk about the metrics, one more ingredient that I really do like to look at is the last mile knowledge. As CUGH is the consortium of universities, many of y'all are undoubtedly academics working on cutting edge research, really discerning best practices and what does the future hold for us. But if y'all's research doesn't make it to the field where it can be applied, then so much of the value it gets lost along the way. I kind of think of it as similar to the post-harvest produce loss. The, the crops are harvested, but they don't make it to the consumer. The research is conducted, but they don't make it to those who can apply it. And this is where the last mile delivery is so important. This is going that last mile down the farm road to the farm, and the farmer, and delivering that knowledge for them to be able to receive and internalize and apply. That is the whole mission of extension agencies. Whether it's your Ministry of Agriculture or in the United States, our extension agencies are tied to the land grant university systems. And it's why my company, IDEA, is the International Development Extension Agency. We work to deliver that knowledge, that research, that final mile to the actual farmer. Training only matters, though, when it becomes habit and survives our staff turnover. Because so often we will begin a project and we'll begin the relationship with the farmer. We will have gone that last mile, but something will interrupt the whole process and it will be cut short. And so, what we like to do is define our core competencies, 5 to 7 essential practices per district based on local priorities and gaps that can be delivered that farmers can use to be empowered and equipped, our communities can apply and benefit from. We want to make sure that our programs are well designed so that what we are looking to deliver and co-develop and apply can actually be received and digested and used. And to that end, IDEA, another shameless plug, has published a book on improving agricultural impact, empowering NGOs to establish and enhance their food security programs. And this is looking at program design so that our work is maximally effective and efficient. We also like to use these micro lessons and coaching rhythms. Instead of one large, one-off workshop, we like to have short, regular visits and demonstrations doing the heavy lifting of the training. We recognize that lead farmers are going to have more influence in their community than any outsider ever can. And the lead farmers and the community educators who can model the practices and solve the problems are going to have the long-term effect, which is, of course, more sustainable, but also is going to be better realized in the long run. We also like to keep our content neutral and inclusive. It needs to be accessible to women and youth and smallholder farmers and large-scale farmers and agribusinesses and everyone in the community. We want to be apolitical in a lot of our work. We don't like to divide communities against one another. We want to empower all. And these are the different strategies we use when going that last mile and working to empower our farmers. Now, when it comes to global health and healthcare, I recognize I'm not a medical doctor. I'm a farmer. There's a whole lot of difference between the healthcare provided at a hospital and clinic and the training and demonstration work provided at a farmer. But one thing that I have found that is true across the board is that developing relationships with our audience, whether it's a farmer or a patient, a hospital director, or anyone else in the community, having that relationship is key. Excuse me, I've talked too much. And so I like to get into the empowerment pathway, trying to put this strategy to work in a simple and effective manner. First, knowledge and agency. Farmer field schools become farmer field habits. When we invite farmers together to participate in the training, to share their ideas, share their successes, share the traditional knowledge, but then also share their challenges, share their frustrations, then together as a community, we find that they cross-pollinate ideas. They share with one another what has worked for them or what hasn't. They can bring up their traditional practices and realize this is a ongoing lasting practice for a good reason, or this is something that's holding me back, and the latest research from many of the academic institutions will help us overcome these challenges. But if we can help the training become a habit, then we're going to see the long-term empowerment. Second, I've said this a few times and I'm going to say it again, local ownership. When communities co-design the activities, when they co-manage and co-maintain the interventions, then they will take ownership because it would have been theirs from the beginning. When it is an outsider, an outside institution or organization coming in and doing something very done in isolation, then the ownership is less likely to transfer in the long run over to the community because it will have always been the outsiders and not the locals. Third, market inclusion. Fair, predictable pathways so that buyers, to the buyers, so that new practices can pay off. When an intervention is introduced and it's not fully mapped out from start to finish, from production to consumption, then oftentimes that intervention is blind to some of the risks that are in the pathway. that are preventing the farmer from realizing the promised gains. And so by inviting everyone in to co-design the system, they are able to bring in their own perspectives and help map out that pathway from the producers to the buyers so that it succeeds, so that the farmers can generate a profit, so that the consumers can afford this new methodology or whatever it produces, and so that everyone can grow and be empowered together. And then fourth, we must have feedback systems, simple, respectful measurements so that communities can see progress and decide what to adjust. And measuring what matters is very important. But having the feedback systems to share if what we are measuring is actually checking on what is happening, or if it's just a bunch of busy work to put a number into an Excel sheet, that's a very different scenario. And so this is what we mean by empowerment, not just participation in a project, but the ability to shape and sustain a local food system that supports health. So how do we measure without drowning our teams in spreadsheets? We like to keep it light, respectful, and useful. Data should serve community decisions and their dignity, not only external reporting. People are not just numbers to be counted. People are individuals with their own lives, and that should be reflected in what we are measuring. So, for practical monthly indicators that we like to use when looking at food security, we like to look at months of adequate food reported by the household. Now, are there leaner months? Are there you know, uh, times when the market is empty, or when the pantry is empty, or when the family doesn't have the income to purchase food? What is that going to look like? And so asking households to report on when is the lean season empowers us, the INGOs, the organizations, the intervention groups to be able to target that low-hanging fruit of improvement. We also like to look at the Household Dietary Diversity Score, and this is a well-developed survey, the HDDS. It uses a simple food group analysis to see what is being consumed. Do they only eat maize porridge, or is there good diversity amongst their food groups? They're getting a well-balanced meal. And that's important to know as well. That's worth measuring. And then once our program or project is underway, we like to look at the adoption rate and see if there are 2 or 3 priority practices that our programs are promoted and how well they're being adopted. And so after our activity, if we conduct a theory of change, and we look at, the inputs we've supplied, the activities we've conducted, the outputs that we are expecting, and then the outcomes that we desire. We want to see if the lessons that we taught in our activity to the number of participants, the outputs, are resulting in the adoption, the outcomes. We want to make sure that we have built that out well in advance, that we know the priority practices that we're promoting. We teach on it. We ensure that those who attended the training, received the training, but then we check up, and this is what I'm trying to get at. We check up on how well they are adopting those practices. Are they successfully implementing them? If they are implementing them but unsuccessfully, is it because those practices were incorrect to promote? Or is it because there is some other obstacle in the way preventing their success? We cannot know if we do not measure. And then we also like to look at simple price signals from local markets for 1 or 2 key foods. Is there a huge spike in the cost of a specific commodity at a certain time of the year? When all the maize that was harvested and sold in the market has been consumed and is no longer available, well, does the cost of maize shoot through the roof? Or are they importing maize from a different district or region or country, causing it to explode in price? What is it? How can we measure those price signals and then be able to adapt our activities, projects, and programs accordingly? We like to collect a lot of our data via WhatsApp, and we use very simple forms. Sometimes we use Google Forms, extremely simple, or Jot form. There's a lot of other products out there for conducting surveys. And we, of course, also still use a lot of simple paper forms when working in low bandwidth environments. The benefit of having a digital form is that you're going to have a standardization of the answers, especially if you build out kind of a multiple choice and they can be selected, as opposed to when people write it in, there might be different names for the same crop. And so you get different answers. And so it's more difficult to compare and contrast. Or maybe there's even just typos causing different problems when it comes to looking at the data. Using WhatsApp, nearly everybody in the entire world uses WhatsApp, except for the Philippines uses Facebook Messenger. And so, no, you need to know what is the common method of communication in your area. But with WhatsApp, it's so simple and straightforward, and there are great WhatsApp products where you can send one question at a time, and as the user submits their response, it gets auto uploaded to a Google Doc or a Microsoft Excel sheet. I'm sorry, I'm in a Google sheet or a Microsoft Excel sheet, and then you have all your data inputted conveniently. When you use these in plain language, the community leaders are able to better digest it, share it, and then each month you can celebrate your progress publicly, and then you're able to show the actual improvement that has happened due to the interventions, activities, and projects. And so 3 to 5 indicators that are gathered monthly and are actually used are far more valuable than 30 indicators that are gathered once a year and then filed away to never be looked at again. I'd say keep it simple. You want to actually measure what matters, and you want to do so in a way that's not going to be a burden, but rather is going to be a benefit and a blessing. Finally, we like to make the health pathways explicit so that teams understand why what we are doing matters. Better diets lead to stronger immunity and recovery. Children grow better. Mothers survive childbirth at higher rates. To go back to the example of my dad and his organization in Haiti, in about a year and a half, I think it was 19 months from the start of the maternal health program, the maternal and perinatal mortality rate was reduced by 75%. Sharing that result with the community led to an absolute celebration. Mothers were living, children were living. The the cemeteries were not as full. I mean, it was very tangible evidence of the success and impact of a project. And we need to make that explicitly clear. Fewer hungry months, lower stress, improves learning and school attendance. When children have full stomachs, they can actually hear the teacher instead of just the sound of their grumbling bellies. When children have full stomachs, their brains can develop and they're able to learn. When children learn, they grow up into adults who are able to apply that learning. And so there's just the multiplicative effect of good food security and nutrition. Higher farm income supports care seeking. It supports healthcare and the preventative measures that so many hospitals tend to get overwhelmed by, the preventative diseases that you know end up not being prevented. But when families can actually pay for treatment, can pay for the transport to the hospital to receive the treatment, well, then we see, just so many more secondary and tertiary effects. And then local procurement strengthens the local institutions. When clinics and schools buy food locally, it helps both the health systems and the food systems at the same time. Many organizations import food from the United States or from the EU. And oftentimes we're able to get that food, donated as a, gift in kind, GIK donation. And it's really hard to say no to that type of.
Are you able to hear me better now?
Yes, we can hear you now.
Okay. I'm sorry. I received a phone call and it interrupted my headphones, and really sorry about that. So, as I was saying, many organizations will import food from the West. That food is often donated as GIK. It's really hard to say no to the donations, but that food, when imported, puts the local agriculture sector out of business. Oftentimes, it's also importing a food that is not culturally appropriate or culturally accepted or locally desired. And so, by procuring locally, we once again strengthen our local ag institutions, but we are also promoting better health systems and food systems at the same time. When we draw these lines, between the better diets and the stronger immunity, the fewer hungry months and the lower stress and better learning, when we draw these lines for our teams and for our partners and for our communities, it becomes easier to justify investing in food security as part of a health program, not just as a separate project. Once again, food security is health security. And that is what I really want to continue to drive home. If we invest in food security, we are investing in the health of our community. So now for poll number 3. Miss Sarah, if you'll put that up. Let us bring this back to your work, you, the individual here on the session. So we have several lanes that I am assuming that many of y'all work within: maternal, newborn, and child health, infectious diseases, non-communicable diseases, mental health, WASH, policy, financing, advocacy, data monitoring and evaluation. I'd like for you to just share with all of us, where does your field intersect with food security? And as you vote, think of one specific program or district where you work. Great responses coming in. Many of y'all are in maternal, newborn, and child health. Wow, it's incredible. Such great work. Give y'all a few more seconds to get your responses in. It is so good to see a true diversity of where everyone is working. And I want to thank Sarah Kellogg from Q, who has been helping with all the polls. Great work. I really appreciate you. All right. Well, let's share those responses. Most of y'all are in the maternal, newborn, and child health field. Looks like second place is a tie between non-communicable diseases and the policy, financing, and social protection. Dr. Martin, thank you for your contribution. Glad you're on the call. Well, fantastic. Thank you all so much. All right, now let's go into this next bit. where I have created a document that, Sarah, I think you will be sharing with everyone after the call along with the slides. And this is a guided action checklist. And so what this is a document. You can see the first page here on the right. It's a field guide that will share with you. Actually, let me just switch over to what it is. So food security is health security field guide by discipline. Hopefully you're able to see this document now. And so I've broken down each of the categories that was in the poll and how you may be able to apply a food security lens to your health security work, your global health work, with action items, suggested metrics, and even suggested partners that you could work with. And so for each of the different categories on the poll, there's a page. You can see it's kind of broken down by topic: mental health, WASH, policy, data monitoring, teaching and training, and then looking at the cross-cutting, nutrition-focused agriculture markets and resilience. And this last page is one that I do want to point out. It's just a cute little activity that we could all do, but just I commit to food security for health security. So write out what your lane is. Write out 2 action steps that you can integrate in the next 30 days. A partner that you'll work with to be involved in this work. The indicators you'll track. What you will use, how you will use the results to adjust decisions. And then where you will share what you've learned. I think sharing is incredibly important. And as we talked about monitoring what matters, many of us may have experience in monitoring and evaluation. At IDEA, we actually like to expand it even farther. We call it MEALS, not just M&E, but MEALS: monitoring, evaluation, analysis, learning, and sharing. The sharing part is one that is often overlooked. How do we share what we've learned? Both good and bad. Like if we had great success, we want to share our great success. If we learned that our hypothesis was incorrect and that we need to return to the drawing board and redesign a new project, we want to share that as well so that others can learn from our mistakes. I see in the comments, many of y'all are asking, where can you get this? It's my understanding that this will be shared with everyone on the call afterwards. So back to our slides. So the checklist, pretty simple. Choose your lane, whether you're maternal, newborn, child health, infectious diseases, etc. Check any 3 actions you can realistically start in the next 30 days. For example, adding a brief food security screen to your clinic visits. When a patient comes in, you screen for the household dietary diversity, or when was the last time you had animal-based protein. Many of y'all are probably already doing many of these things, but now we have a connection between your healthcare activities with the food security lens. Maybe you connect one clinic to a local producer group, a crop or commodity producer group, or starting a monthly 3-indicator pulse. How often are we checking on the indicators related to food security? I think it's important to assign an owner, a partner, and a 1 metric per action. This might be a district nutrition officer or a faculty member. And so finding out who is going to take lead on the action, on measuring that metric, on involving and connecting with the partner. Another thing we like to do is always have a good responsibility assignment plan for who is going to be doing the work. It's a pretty standard business term, but a RACI matrix, RACI: responsible, accountable, consulted, and informed. And so if you're going to be having a good action-oriented initiative, make sure you have that well assigned. And then review your work at 60 days, 90 days, going on, and share that 1-page learning note with your team or your ministry counterpart, or with the greater Q community. So for tracking, we suggest just tracking three standard indicators. Like I said, the household dietary diversity, the months of adequate household food provisioning, the adoption of two key practices. Look at a local price signal. Pick the different metric that is going to be really important for your initiative. Measure what matters. And so, in the chat, if anyone is interested, please share three actions that you are leaning toward that will give others ideas. And as we like to say in the agriculture world, cross-pollinate these ideas with others. So go ahead and flood the comment section, and I'll try to read some of those as well. So I really want to show the full chain of events, the cycle of how agricultural development delivers health security. On the left, if we develop agriculture, if we empower farmers through extension and field schools, if we reduce losses with storage and aggregation, if we focus on nutritious crops like legumes and vegetables and build climate resilience, then that leads to stronger food security, more food in the system year round, shorter supply chains, predictable buyer days, fairer prices, higher quality and diversity of foods, which in turn leads to better health security, improved maternal, newborn, and child health, better infectious disease outcomes, more stable NCD management, communities that are less shaken by shocks, which of course empowers the agriculture sector to be better developed, leading to the cycle to continue in a positive way. So the main point is that agricultural development is not a parallel track to your global health work. It is a core lever for improving the health outcomes you already are working towards. But once again, food security is health security. I hope that I've been somewhat effective in convincing all of y'all of the integration of these two subjects. By empowering farmers and communities, by stabilizing local food systems, we can reduce preventable illness, we can improve recovery, and we can build resilience that lasts beyond any single project. The work is challenging, no question, but it is deeply rewarding and very achievable when we focus on the dignity, agency, and sustainability of our communities. So, as y'all go back to your teaching, your research, your programs, I'd love for y'all to look for one place where you can add a food security component, whether it's a dashboard, a screening, a partnership, a procurement change, a small pilot, whatever it may be. Then measure it and share what you learned so this wonderful community, this consortium of universities for global health can grow together. I do have resources that I'd love to share. Of course, we have our published resources on our website with manuals and toolkits. Want to make sure that these slides are available for everyone, as well as the downloadable one-page action checklist. We have lots of indicators and templates for monthly tracking. One thing that I meant to have handy is we have a theory of change. I don't know where I put it. We have a theory of change mapping tablet so that our partners can build out their whole action plan for inputs, activities, outputs, outcomes, impacts, uh, risks, and assumptions. I wish I had that to share with you all. But then we also have a workbook on, we call it Harvesting Impact. It's our program design workbook to build out your program from scratch all the way through the end. Everything is designed to be adapted to whatever context you may be working in. And so if you would like to co-design a pilot, integrate this into a course, or explore an institutional partnership, you can reach me at david@idea.ag or go through our website, idea.ag. Now, I know we have a Q&A that we will be getting at. let's see. Let me get to the Q&A. Here we go. So I know that many of y'all have been putting questions into the chat. If you could instead put your questions for the Q&A into the Q&A part of Zoom, I'll be able to see these and answer these more directly. But I will also try to look at the ones in chat as well. And I know Sarah is filtering those and tagging me in many of them so that I don't miss them. So I do have a few questions up on the screen that I would like for y'all to be considering. And so if you want to share an answer, that would be great. But then also I'm going to try to answer these questions in the Q&A. So McKenna Frenia asks, do you do any work to address food insecurities in cities? Great question. There we go. Yes, McKenna, that is wonderful. So addressing food insecurity can be handled in many different ways. I prefer to handle food insecurity through agricultural development, but going back to that Venn diagram of availability, accessibility, and affordability, those can all be improved through increasing local production and empowering farmers with better knowledge of how to produce, especially longer throughout the year, not just in the traditional growing seasons. When food is produced locally, it is now more available, accessible, and affordable in the cities. But if you're asking about agricultural development in an urban context, urban agriculture takes a very different form and often requires a lot of flexibility and creativity. Space is typically the limiting factor. The local city is made up of buildings, homes, offices, businesses. And so there's not just wide open fields in the middle of the city to be cultivated. Of course, we can always do small scale urban gardening, anything from flower pots to growing on your rooftop. But typically, if we want to improve food security in a city, we need to go outside the city to the surrounding farming communities to then grow the food that goes into the city. The city is always going to be the major market. That is where the demand is highest. And so if we can supply more to that city, that helps with food security there. All right, Nick Bass. Do hydroponic techniques effectively address soil and nutrient issues as well as yields? And where would this work best or not so well? Great question, Nick. I've done a lot of work with hydroponic, also aquaponic, and integrating a fish production system into the hydroponic cultivation of plants. What the fish provide is their waste, their manure, so to speak, can be oftentimes be a fertilizer for the plants. What I have found with hydroponic and aquaponic and aquaculture is that more often than not, if you invest a very little bit into a very small project, it'll work just fine. If you invest a whole lot into a huge project, it works great. If you invest a medium amount into a medium project, it's going to fail. Can't exactly tell you why, but every time I've worked on kind of that in between, it's not the best of both worlds. It's the worst of both worlds. And you end up getting a lot of wastage and not much productivity. As an example, worked with the Ministry of Agriculture of the Palestinian Authority in the West Bank, working with them on some of their hydroponic and aquaponic projects. And they just kept saying, our inputs, the expense of our inputs dramatically outweigh our outputs. We are putting more into the system than we are getting out. And it's because they had built kind of a medium-sized project. But your question of does it effectively address soil and nutrient issues? Well, soil is not typically a component in a hydroponic system. Now, you are not putting a burden on the soils in the fields because instead you are cultivating within this enclosed hydroponic system. But nutrient issues must be externally supplied. So the benefit of growing in the soil is the soil typically has a lot of nutrients. The downside of growing in water and hydroponic is that you have to add those nutrients. And so you need to have access to the water-soluble fertilizers, and that adds up quickly in terms of cost. Where does this work best? It works best in an urban environment. You don't need large amounts of land. Oftentimes, hydroponic is grown inside of a shipping container. There are some great organizations, companies that have built out shipping container hydroponic garden products. Now, they are energy demanding. They have to have a constant supply of grow lights of the water being cycled and pumped through the hydroponic system. There needs to be fans and temperature regulation. And so you need to have access to a good electricity source. Hope that answered your question.
David,
Dr. Keith Martin. Oh, yes, ma'am, Sarah.
sorry. There was one comment in the chat from Leslie Owusu, going back to your cassava conversation. And she noted that she can understand the hesitancy around cassava, but we must remember that the traditional ways in which we as Africans prepare foods like cassava take all this into consideration. For example, fermenting significantly reduces the cyanide content and is what many of these cultures practice. So I thought you just might want to respond or comment on that.
Thank you so much. Would you mind telling me her name again?
Leslie Owusu.
Leslie, great comment. And I hear this a lot, and I respect the comment tremendously. Yes, we must take into consideration the cultural practices. As a note, especially I don't know where you're from, but if you are taking an African perspective, cassava is not from Africa. Cassava is from Brazil, kind of the central Amazon area. It is much more indigenous throughout Latin America and the Caribbean. It was primarily introduced to Africa in about 1980 as a food crop that did not require much energy or input into production, so that the countries would instead focus on cash crops to be exported on the global market instead of food crops that would feed their own people. And so it has a pretty devious history, starting out from that perspective. Secondly, yes, when processed correctly, you can get the cyanide out, no question. I have eaten probably hundreds of kilos of cassava in my life, and I'm not dead yet. Emphasis on yet. It can be done well. Um, the problem is the method of processing cassava to adequately get the cyanide out requires large amounts of fresh water and large amounts of cooking fuel, whether that's firewood or oil or propane or whatever it may be. So, in our rural communities where water is often a costly commodity. It requires long distance transportation, lots of time spent fetching water and bringing it back. Using the adequate quantity of water to soak our cassava properly, well, that's a pretty easy corner to cut where I don't want to sacrifice this water that I just spent hours fetching from the local water source on processing my cassava. So that corner gets cut and less water is used than is required. Secondly, cassava needs to be boiled and needs to be boiled in a fresh batch of water, not just the original batch that it was soaked in. And when, firewood, when cooking fuel is used, how much do you want to use? You want to use the least amount you can get by with, because once again, that's another precious commodity. And so, is it boiled long enough? Oftentimes it's not. In my observation and experiences, that's another corner that gets cut. Thirdly, cassava is known as a drought food. This is what communities grow to have something to eat during the dry season. During the dry season, cassava lives. It does not die like a lot of other crops do. During the dry season, it increases the cyanide in the tuber by up to 200%. So the food that is being grown to help you survive the drought is killing you more because of the drought. So back to the first two issues. During the drought, the cyanide is higher. During the drought, you have less access to water. And so you're less likely to properly soak and boil the cassava. because you're in the middle of a drought. This is not any condemnation on the people growing or consuming cassava. Please do not hear that. This is simply a recognition of the dangers of cassava. And so cassava can be processed correctly. Of course it can, no question. The question is cassava being processed correctly? I know I was teaching on this in northern Uganda, South Sudan, got lots of pushback from the farmers I was working with. And that day in the local newspaper, there was an article about how 186 people died from cassava poisoning from a local cassava bakery. Professional business, should have been doing things right, but they did not process it correctly. And cassava flour that was made into a bread product caused mass death. Now, it's a touchy subject. Cassava is near and dear to a lot of people's hearts. I get that. And so I do want to emphasize it's not condemnation. Also, it's typically not immediate death. I like to say cassava consumption is more like death from 1,000 cuts. It's not, a sword chopping you in half. It's more like a little razor blade, just a little cut at a time, a little cut at a time, a little cut at a time. The more cassava you absorb, the more your thyroid is damaged and the less iodine your body is capable of absorbing. So I can show you the data. It's in my publication on cassava. Lots of research shows that the overwhelming prevalence of goiters, especially throughout low and middle income countries, are caused by cyanosis preventing iodine absorption. And so, once again, food security is health security. People consuming cassava causing an extra burden on the local healthcare system. These goiters, these painfully enlarged thyroids, most frequently caused by cassava consumption. Also, wasting diseases, many different types are linked directly as a causative to cassava consumption. Do want to respect cultural practices. No question, that must be done. That goes back to that local ownership and empowerment. But if we can empower our communities to cultivate and produce nutritious foods, like pigeon peas, the reason I'm so big on pigeon peas is they are just as drought tolerant as cassava, but they are actually high in protein as compared to cassava has none. They are have great fats. Cassava has basically none. The only thing cassava has is carbohydrates and calories. But if we can grow an alternative, we're going to see health improve as well. Ms. Leslie, I hope that was helpful. I would love to continue this dialogue with you because it's certainly a topic that I can uh, wax less eloquently on for a long time. All right, Dr. Martin, what would I do to reduce deforestation? For example, in the Amazon, how can ag coexist with protecting ecosystems? Great question. Deforestation is certainly a very important issue to discuss. And like your example in the Amazon is often directly tied to very harmful agriculture practices. So the slash and burn methods that are too commonly employed are very short-sighted, and they are either done out of desperation, which is typically the smallholder farmer approach. They are desperate for some harvest that they can sell, or they are done by exploitation, large-scale agriculture that cares a lot more about profit than they do about sustainability. This is where education comes in, especially on the smallholder side. If we can educate farmers on better practices so that they are able to steward the soil, steward the ecosystem, which is going to benefit them in the long run, and they're able to generate a profit and have a good agribusiness, so to speak, then we're able to have a protected ecosystem and an empowered farmer. Like I said, that requires education and training. When it comes to deforestation, agriculture often employs reforestation, especially as we look at the integration of trees into our farming systems. In Haiti, where I lived for about 5 years, um, one of the crops that I grew most frequently is called Moringa oleifera. It's a very fast-growing tree, and actually the leaves of the tree are very nutritious. Um, More protein than chicken, more iron and calcium than milk, and more vitamin C than oranges, gram per gram. But they also are very productive in producing seeds. And so on my farm, I had about 1,000 moringa trees, and I would fill up empty rice sacks with the seeds. And every time I would go out and do a farmer visit and do some extension work in the community, I'd take a sack of seeds with me and just be scattering them along the barren hillsides as I went. And over the course of a number of years, we went from very rocky, deforested, barren hillsides to now we have just trees growing everywhere, and not just the moringa, but the moringa started kind of that lower canopy that allowed the larger trees to grow up, and now we have a diversity of trees throughout the area. But by integrating the tree production with our crops, we're able to have significantly, exponentially improved benefit. Dr. Martin, I'm going to skip your next question, but I'll try to come back to it. Joshua, you ask, what are some go-to market challenges of stabilizing the market through agricultural development? My goodness, that is a good question. I would say the first challenge is typically resistance to change, and especially amongst those who are benefiting from the status quo of the system. Oftentimes, the middlemen are the ones who make the profit. A farmer, does all the work cultivating and harvesting, but then they get exploited with the farm gate price by a middleman who comes in and pays, a penny on the dollar. But then that middleman goes to the market and sells it for, 100% markup. And they, are able to pocket that difference, that profit margin, having done little work other than transportation. Now, transportation is important. It's vital. It must happen. But if it's done in an exploitative manner, then you're getting a high price in the market. So the consumers are paying high, but a low price for the farmers. And so they are barely able to afford, if able, to continue farming and producing that food. And so the best way I find of stabilizing the market is empowering the farmer to sell more directly. There's typically multiple levels of middlemen in there. And if we can streamline the efficiency of that middle process, we're able to reduce that final consumer price and improve that initial farmer's price. And I find that stabilizes the entire system more than anything. But you're going to have to deal with that resistance to change. All right. Anonymous attendee asks, do you have any suggestions for how to support local food systems in impoverished rural areas where farmers have little opportunity to make a profit? Oh my goodness, great question. Thank you so much for asking this. It often helps to look at the whys behind the what. And so, why are the farmers unable to have any of these opportunities to make a profit? Is it due to a disconnect in the system? Are they disconnected from the markets where they could be selling for a better profit? Is it due to an ignorance of best practices? They lack the opportunity to learn what the institutions and research institutions and universities are putting out. And so they lack training, and that is preventing their ability to make a profit. Is there something else like conflict or climate or politics that are preventing them from succeeding? Finding out the why behind the what allows us to better determine how we are going to move forward. And so whether we are in, I've got a lot of work in South Sudan right now, a lot of conflict, a lot of flooding, a lot of different issues going on. But finding out how to best empower farmers to support the local food system, requires very flexible approaches. What works in, you know, Western Equatoria is different from Central Equatoria there in South Sudan. And so a one size fits all doesn't usually work. But if there is a category that is most often most effective, it is educate empowerment through education, empowering farmers with knowledge so that they may apply that and benefit from the practices. So that'd be my suggestion for supporting local food systems. Empower the farmers with the skills that they need to improve their productivity. Let's see. Man, we're getting some great questions from a lot of the same people. So Joshua asks, what are some commercial determinants of health that can intervene in the food security model? Commercial determinants of health. I'm sorry, Joshua, I don't exactly know what you mean by commercial determinants. Um, is that more like products that can be sold and purchased? Joshua, if you'll put that into the chat, I'll try to come back to that one. But I do see that you said cassava. Does that equal mandioca? It probably does. If you'll tell me what language you're referencing. I know in Haiti the word for cassava is manioc, and it's also often called tapioca, especially when processed into a flour or pudding. And so that could be what the mandioca. It could be what you're referencing. Okay. And then yes, if you'll respond by what you mean by commercial determinants, I'll try to come back to that one. McKenna asks, do I help connect farmers with solar powered irrigation and funding? McKenna, great idea because yes, that is often a wonderful solution. Water is often a limiting factor to productivity on a farm. And so if farmers can have better access to water through solar powered pumps, um, then we find that that has just unlocks tremendous opportunities for productivity. IDEA typically works through local partners, local NGOs, the Ministry of Agriculture. And so while we do not connect the funding opportunity to the farmers, we typically will suggest different opportunities and point out where funding can be procured. But solar powered irrigation is certainly one that we have worked with in the past to great success, especially when pumping can be energy intensive, and most farmers will end up renting a small generator unit to run an electric pump, and that's not very cost effective. Okay, Joshua, in the chat, you said commercial determinants of health of the private sector's activities that affect the health of populations, both positively and negatively. These include factors like the marketing and production of harmful products, e.g., tobacco, ultra-processed food, alcohol, as well as lobbying and influencing policies, and shaping the social and physical environments in which people live and work. Commercial determinants of health also encompasses positive influences such as the products and services for industries like sports or medicine. Joshua, thank you so much for clarifying that for me. I've learned something great today. So thank you very much. So back to your question, what are some commercial determinants of health that can intervene in the food security model? Well, if some of the harmful products, not to harp on this topic too much, if the harmful products could be promotion of cassava, cassava cultivation and consumption, then I would see that as a commercial determinant of health that is hurting food security and hurting health security in a community. As far as positive influences, this is where I promote like pigeon peas or other type of high protein, vegetable-based protein from legumes. We do a lot of work with animal based protein as well. if we're going to be promoting these positive influences in a product or service form, then oftentimes what we do is help establish agribusinesses that can produce these products. And so, for instance, in India, we started agribusinesses that were actually goat breeding businesses where we attained a high quality strain of goats, great genetics, very high food to weight ratio, very disease resistant, and great demand in the market. But we did not sell these goats to the local butcher shop. We sold these goats as breed stock to local goat farmers so that they could improve the genetic strains of their herds. And so that would be one of the products that we helped develop to improve the food security in the community via empowering the farmers with the better quality product, better quality goats. Josh, I hope that was helpful. All right. Let's see. Martha Fuller, do you have examples of healthcare providers partnering with agriculture to improve food security and health? We know to screen for food insecurity, but many of us don't know how to partner with farmers. Oh, Martha, great question. Wow. I like that. I like that a lot. Yes, I can give you a number of different examples. Wow, where to start? So in Haiti, I worked a lot with the Ministry of Agriculture. I would partner with the agronomes, which were basically their ag extension agents. And we would conduct a lot of training in the community alongside of the healthcare providers, whether this was NGOs or even some of the government clinics. What we would try to do is, bring this food security as health security dialogue to the combined community groups, but then do it in a way so that the farmers could see the services provided by the clinics, the organizations, but then the organizations could also see these are the farmers in the community that if you procure your grocery, your ingredients for your kitchen, that you're serving in your clinics from these farmers, there's going to be that compounding effect. And so to plug my dad and his organization again, in India, they have a number of impressive maternal health clinics where they are serving hundreds and hundreds of pregnant and nursing women. And they provide food for the women that come into the clinic each time. That food needs to be procured locally. Well, we partner, IDEA comes alongside and partners with the farmers to help them produce their food more efficiently, more effectively, with higher quality at the standards that live beyond its expecting, making sure that we are, not going to deliver something contaminated or moldy. And at the same time, we've produced a series of educational videos in the local language that are contextualized for that community that run on a TV in the waiting room at the clinic so that when the mothers are in there waiting their turn to be seen by the doctors and nurses, they are receiving training on household garden strategies and techniques. And so by bringing the two different communities together, the patient community for the clinic and the farming community, we're able to have that integrated, interwoven level of services that has such a great exponential impact. Other examples would be in Uganda, the Ministry of Agriculture, Animal Industries, and Fisheries that I work quite a bit with. We also try to bring in the local Ministry of Health, and we conduct a lot of our trainings at different clinic sites, or we'll have a kind of a neutral community center where a lot of our trainings will take place so that both groups get to, both organizations get to speak to the same audience, and their shared messaging is able to be seen from different perspectives. I did a lot of work in the Bahamas with the Ministry of Agriculture, and we would often do the same thing where the agricultural work would coincide with a lot of the healthcare work. I give examples from Afghanistan, Philippines, Laos, Ghana, etc. But typically, there has to be someone who is pushing this change on both fronts. And so, if we want to go back to, my slide of our guided action checklist, that could be you, Martha, who are connecting with the healthcare providers and the Ministry of Agriculture or the local ag extension agents or some agricultural cooperative or someone in the community that's a farmer and trying to bring these two worlds together to better integrate the messaging and the outcomes. All right. Ashraf asks, when a country has limited institutional capacity to manage food insecurity, what models or methodologies exist to help communities coordinate their own response? How can civil society build a resilient, community-driven food system, even when national leadership is absent? Oh my goodness, Ashraf, great question. And I think civil society is the best way to build a resilient, community-driven food system. And that national leadership, it's always wonderful to have them involved. Make sure we don't, try to be under the table or anything like that. But local change is going to be more lasting. A top-down approach, um, does have its time and place, but a grassroots approach is going to be much more impactful. And so, how do we empower our local civil societies to build that resilient, community-driven food system? That empowerment, go back to the slide on empowerment, but really working with the thought leaders, the community leaders, whether it's with different religious institutions, you're going to find people who hold sway in the community. And if you can convince them of the benefits of these interventions, then their word is going to carry a whole lot more weight than any outsider. In fact, there's a textbook that I always keep close by. Diffusion, oh, cut the blur. Diffusion of Innovations by Everett M. Rogers. It's a big old fat textbook that I reference all the time. And it looks at exactly how do we do that community empowerment through incorporating local leadership, the thought leaders, the opinion leaders, folks like that. This is also where I find demonstration farms are very effective. I can come in and give a lecture, and it's kind of like, who does this guy think he is? You're not from here. You don't know what our day is like, our daily life is like. And so you're pushing this initiative, and I, David, don't have any of the risk when it comes to giving a lecture. And the farmers, if they are going to take me at my word, they are taking all the risk on themselves to go home and adopt and apply what I taught. And so, better than just giving a simple lecture, I find that demonstration farms are incredibly effective, where it requires a much, longer investment in the community. I can't just fly in and fly out the next day, but go in, develop the relationships, somehow lease a little bit of land to be able to demonstrate the techniques I'm teaching. And so, here's the traditional method. Here is the method that we are pushing. Let's practice them both simultaneously, side by side. And then you, the farmer, are able to observe which method is more successful. And I am therefore more likely to convince you that my method works when you see that it produced more, it produced better, it was more effective in what it promised. Also, working with farmers to adopt incrementally. So, look, I'm not asking you to just switch completely overnight, but would you consider taking 10% of your farm and applying the method that we worked and continue the 90% of your farm doing it your method? But over the season, if you'll give me like a true commitment, if you find that 10% is doing better than your 90%, next season, will you increase it to 25%, 50%? Maybe they're ready to go all in. But Empowering the civil societies to build resilient, community-driven food systems, I find requires education, training, relationship, the opinion leaders, the buy-in, the ownership from the local leadership, and then also taking some of the risk on ourselves to show that one, we're committed to this, but two, that the farmers can observe the value that typically has huge effect. And I find that that's worked very well in my experiences. Sarah, I see the time check. Thank you so much. I'll try to get to at least one more question. Lori Ann asks, as a family physician, I love recommending gardening, bucket, balcony, or backyard as exercise, wellness, or for food. For small backyard gardeners, those new to community gardens who may lack the knowledge and experience to safely start growing, what is an online resource others can consult before planting crops, such as cassava, versus the gung-ho pigeon peas? I trust info from UF, IFAS, yeah, University of Florida. The Institute of Food and Agriculture is incredible. It's a great one. But you say it's more local to you. What would I recommend for international resources? Great questions, Lorianne. Love it. What I find is I first always go to that country's Ministry of Agriculture website. They typically have their own publications that are, of course, more appropriate for the context of their own country. And so, first and foremost, I go to the local ministry website to find what they have. Some countries have a whole lot more than others. And so, that is going to be different for each place you work. And some countries may have great resources in one topic, but lacking in other topics. So, Uganda as another example, because I'm doing so much work there right now. Incredible resources on pigeon peas, actually, and on bean cultivation. And so I just straight up share directly from the government to the farmers. Sometimes I will take the government publication and break it down into a slide deck, something like this, so that when I'm teaching, it's not just, hundreds and hundreds of pages of texts, but it has more, pictures and diagrams and stuff, but always giving citations and credit to the actual researchers. But oftentimes there's also a gap in specific topics that are being taught, in which case I tend to try to Frankenstein different sources together into a working resource, or I just make my own. Other great resources, if you're there in Florida, I highly recommend ECHO. That's ECHO. It stands for Educational Concerns for Hunger Organization. They are a remarkable agriculture research organization based there in Fort Myers, Florida, focused on low and middle income countries, specifically in the tropics. And they put out tons of resources on specific crops and animals for cultivation, for production, and for food security. ECHO's website, which I think is echonet.org, and then also echocommunity.org. I reference them pretty much every single day. Great, great group doing great research and developed specifically for the tropics. The Food and Agriculture Organization of the United Nations also has tons of publications. They're often very high level, like 100,000-foot view. And so typically not written with the farmer in mind, typically more policy oriented, but they do contain a wealth of knowledge that can be recontextualized for wherever you're working. Other academic institutions, I'm a graduate of Texas A&M University, Giga Maggies. We put out a lot of good stuff as well. But the land grant universities in the United States are the ones who are conducting a lot of the agriculture research. And many of them do have an international focus. And so they're great ones to reference. Cornell University, one of the best. University of California, Davis, also one of the best. UC Davis had the State Department contract to research and produce publications for Afghanistan. And so when I was there, I used the UC Davis publications constantly because they had just incredible knowledge, incredible stuff. Lorianne, great question. Let's see, I've got 3 minutes. I'll try to answer anonymous attendee. Could you elaborate more on nutrition or food security and the impact on learning education? Any resources I'd recommend for a deeper dive into that? Okay, great question. So if you're asking about the correlation between improved nutrient consumption in students and the impact on their ability to learn in school. I know there are a lot of great resources out there on that. Um, I wish I could cite one immediately, but I know that I have referenced quite a few of those in some of my other publications, and so I could look at my works cited, uh, but I don't think I can do it fast enough. But that is a great question, and so I do know there's a lot of study that is done on that. All right. I think my time is up. Thank you all so much for your patience and endurance going through this session. I hope this has been beneficial to y'all. Thank you all for having me here at Q. I really love the community that y'all have, and I hope you enjoy the whole rest of the global health seminars that are going on. Hope y'all have a wonderful day. We'll send y'all the slides and that document. And if you have any questions, please email me, david@idea.ag. That's .ag as in agriculture. Hope you all have a great